Good day. My name is Danielle Rigby, and I am presenting the importance of bed making in PMH. The objectives. Why is bed making in PMH important? The importance of bed making to a patient's recovery and the nursing bed making process. Introduction. From the neonatal ward to the adult ward, all the way to the geriatric ward, bed making is an essential component in nursing. It is essential to a patient's recovery. Why is bed making important? The bed is where the patient is placed in order to rest and recover from the ailments that have affected them. By making the bed and changing the sheets, the patients can get better, free from excess body fluids. Being placed in a comfortable and clean environment, this is one complication patients will not have to worry about. The purpose of bed making to a patient's recovery. The main purposes of bed making are to prevent complications by ensuring comfort and security to the patient, to provide rest and sleep, to provide physical and psychological comfort, to establish an effective nurse patient relationship, to promote freshness and cleanliness, to observe, identify, and prevent patient complications, to accommodate the patient's needs, to eliminate irritants to the skin from the patient's body, to dispose of soiled and dirty linens. And we know that in the Bahamas, PMH is a place that can uphold more of their cleanliness and their freshness. You've had you can see where patients have been in beds, longer times, and then they suffer from pressure wounds, and those pressure wounds are so painful. They can suffer from many other nosocomial infections, but they could have received on the ward, and the bed is just the most comfortable place. So, it is very important for a patient's recovery. Okay, so making an occupied bed. So this is just a short video just demonstrating how to make an occupied bed and the steps you take when making the bed. So in this video, they show step by step the procedures that what you do when you make the bed. When you go into a patient, you always explain to them the procedure so that they know what's happening. And then you get your equipment together. Okay. So that was just the process of what nurses, student nurses, and TCNs have to go through on the ward when making an occupied bed. So student nurses and the process of making beds. So in a study done on third and fourth year universities of the Bahamas nursing students and their ability to complete the bed making process in its entirety, student nurses indicated that 13% of students do not know how to properly make the hospital bed. And these are just some of my results that I received when I did my survey from SurveyMonkey. And the question was, bed making is an important aspect of nursing. 50% of the participants agreed that bed making is an important aspect of nursing. And I was hoping it would have been more because, but most people you have your opinion. So 50% of the participants believe that. Next question is, it is easy to change the bed sheets with the patient in it. And we have, of the participants, 45.45% disagreed that it is easy to make the bed, to make an occupied bed. And I have to agree with them, that is a very tedious job, especially when you have to do it, by yourself. Because in most cases in PMH, you are short staffed and you have to make sure that your patient is given the best and the most adequate care. So, my discussion. So the results indicate that while the bed making process is an important aspect of the nursing procedure, this process is not always afforded the dedication it requires. The steps in the process that are altered or skipped entirely indicate a need for re-education and dedication to an action that can only improve a patient's overall health and well-being, but also that the nurses are performing the task. The data also indicates that there is room for improvement in this process. It is it is it is that the steps are needed and the time spent on the bed making process is lengthy, which can not only be a hindrance to the patients but also the nurses and should be approved upon in order. It should be approved upon in order to provide better care. In conclusion, the bed making process, though intricate and timely, is an asset to patients. It is shown that it can benefit patients and aid in their recovery process. The prevention of wounds and other illnesses having a clean and comfortable bed are an important aspect in hospital care. And these are just the references that I used for my project. And thank you so much, and you all have a good day.